So welcome everybody to the research seminar sponsored by the College of Public Health and Human Sciences. And I'm Marie Harvey, Associate Dean for Research, and I'm pleased that you're joining us today. This is the first seminar of our spring series, and you are in for a treat. So I'm also pleased to introduce Javier Nieto, who's Dean of the College of Public Health and Human Sciences, and he's a professor in epidemiology. And he will be introducing today's speaker, and he'll be moderating the session, and he'll also provide a few instructions for the format of the seminar. So without further delay, let's get started, and join me in welcoming Javier Nieto. Javier, take it over.
Hi, Mary. Thank you. Thanks. And thanks, everybody, for joining us in our inaugural seminar for this series in the spring of 2021, our seminar series. So before I introduce the speaker today, I'd like to remind you about some housekeeping issues. This is a webinar format, so we have muted all your microphones. If you want to ask a question, please use the Q&A feature. I will be at the end of the Q&A section after the talk. I will be monitoring the Q&A and asking the questions to our speaker. And now it's my pleasure to introduce to you our speaker today, Charlie Fotting. Even though he probably needs very little introduction, I'm perfectly aware that many of you have the privilege, like me, myself, the privilege of working with Charlie over the last couple of decades, and during his tenure at the Benton County Health Department. Charlie was the public health administrator and deputy director of public health in Benton County until he decided to retire this last winter. What some of you may not know is that Charlie had extensive professional experience before he came to Benton County in 2001. He worked for more than a decade in refugee relief projects in Northeast Africa and South Asia, and also worked as a public health director for a native health corporation in Alaska. In 2005, he took a leave of absence from his work in Benton County to lead an evaluation and reconstruction effort of a planning team in a tsunami struck area in Southeast India, in the coast of India, where more than 20,000 people died and 400,000 people were left homeless. Charlie earned a bachelor's degree in nursing from University of Wyoming and an MPH in reproductive and international health from University of Michigan School of Public Health. In Benton County, of course, as a public health deputy director, he's worked in a whole host of public health issues during his tenure, 20-year tenure in the county, in all aspects of public health, immunizations, communicable diseases, environmental regulation, emergency preparedness, chronic disease prevention, et cetera, But he also has had an important leadership role in areas such as the integration of public health services and behavioral health and primary health care. He has served as president of the Oregon Public Health Association and served also as chair of the Conference of Local Public Health Officials, the CLOP organization. She has also served in a governor's task force on the future of Oregon public health. Charlie has received many awards in recognition of his work, including an Alumni Recognition Award with the University of Wyoming, the Florence Nightingale Nursing Achievement Award from the OPHA, and in 2018, he received our College Supporter Impact Award. Charlie has been an extraordinary partner for the college and for OSU in general in our work. in many aspects that are too many to list here, but I would perhaps highlight his role in helping the university control the meningococcal outbreak 3 or 4 years ago. And more recently, of course, the work to mitigate and control the COVID epidemic. I personally have had the privilege of working with Charlie on the implementation, the development of the plan and the implementation of the TRACE project. His support and insights were tremendously helpful in making this project a success. Obviously, this has been a special and critical year for public health. He chose quite a significant moment to retire, retiring with a bang. And of course, we're going to be talking about this year in the future for many, many, many years to come, about what has happened and what could have been done better. And so I'm really happy that we are very fortunate to have that Charlie agreed to come to join us today to give us some early hindsights from his perspective on managing this epidemic in the county, and informed by his extensive experience and what kind of challenges and opportunities this has brought to public health. So thank you very much again, Charlie, for joining us today and for your thoughts, and I look forward for a spirited conversation. Thank you.
Thank you so much, Javier and Marie. It's a pleasure, even though I can't see all of you out there, I know many of you. I look forward to meeting and getting to know more of you. I'm not going anywhere. I still reside in Corvallis, and look forward to continuing to be engaged in with OSU and in public health. I really appreciate it. Okay, Jacob, if we can go to the slides. And so let's go right to the next slide. And I want to wish everyone a happy National Public Health Week. Friday of Public Health Week, sun is shining, weather's going to warm up. We're in a good place. Public health is in the US lexicon as it's seldom ever been before, certainly not in the timeline of my career or really any of our lives, although with the paradoxical effect that everyone out there, and most especially the pundits and people who have never really paid a lot of attention to public health in the past, are now all armchair epidemiologists, which is a bit frustrating at times, but also offers us a lot of opportunities, sort of singular opportunities to use the headlines and use the highlight that we have to move public health ahead. Getting right into this last year, one of my jobs at Benton County was being the director of our communicable disease intervention and treatment team. And so, you know, that our job was to partly to monitor and watch sort of the alerts and what's going on around the world. And here, being in a university community, you know, we had experience with globally transmitted measles. We were on alert for SARS, of course, H1N1 in 2009, 2010, and then meningococcal disease. Are acutely aware that we live in a global community. And so we paid attention when this report of a novel respiratory illness first popped up out of China in December 2019. We'd seen these things pop up before. We always pay attention to them. wondering if it will be the big one. And this time things gained traction and really took off. So now we're 15 months into this event. A lot of water's gone under the bridge. And although the emphasis right now is so much on vaccination, I actually retired on December 31st. And that was just 20 days after the Pfizer vaccine.
You addressed that are so important and so fascinating. I mean, you talked about the challenges and the opportunities. You talked about the fact that everybody knows now what epidemiology is and what public health is, or most people do.
I think they do.
And you wrote that piece, that great piece. I love your op-ed piece in the Gazette Times a little while ago on the time to fund public health, and you use these great analogies of an old car that is not well kept, and then is asked to win the Daytona race, or the firefighters team that is underfunded and then asked to solve that, respond to a crisis. And there's it appears to be it appears to be interested in increasing the funding for public health in the next, and you talked about that. You also talked about the need for public health to regain the trust, and to more than try to wonder why people are not trusting us, try to understand why and what can do better. Of course, public health and the police powers of public health have always been controversial, particularly among people with certain political tendencies who don't like our government to tell us what to do or what not to do, regulations, taxes, etc. But this last year was special, was different. You have public health colleagues not only humiliated, but actually threatened. And people who left their jobs because they were afraid, they were scared for them and their families. We have talked about this, we have seen that in the press, and I'm sure you know colleagues who have experienced that. That's different, that's going a little bit beyond what we are used in, just being controversial on asking people to do things or regulating things. So my question, sorry, it's a long and winding, but my question is that, what is your prediction as to how, what's the long-term impact of what happened this last year? And what's, is that going to remain, or you think that we have, that's going to change and we go back to normal, although I understand you don't want to go back to normal.
Yeah, well, my fear is that it will go back to normal in a number of ways. And one is that, when the next headlines take over, whether that's, another catastrophic hurricane or wildfire season, whatever it is, that we'll see a repeat of what happened after. In 2001, there was the 9/11 attacks, and followed immediately by the anthrax attack in Florida. And through 9/11, and then reinforced by anthrax, there was a huge fear of bioterrorism. And so, Congress allocated a ton of money. The public health emergency preparedness system was initiated. We had money falling out of the sky at that time. We literally had enough resources to shut down the entire health department for 2 days a year and do full-scale emergency drills. And we're doing a tremendous amount of national planning, but that lasted about 2 years. And the money started fading away. Nothing happened. There were no bioterrorist attacks. And so things started eroding. And, by the time 2009, 2010 came along and we were actually facing a global flu pandemic, we were right essentially where we are now. with baseline funding, baseline attention. We're a fickle society. We've got a fickle political system. So I worry that the memory of this will fade. I worry that it will not fade for the professionals, and that the long-term effects, even the people that hung in there through the type of criticism and pressure that they got, and just by dint of their personal tenacity, managed to hold out through public and political pressure. In another year or two, that exhaustion will really take hold. They'll have restabilized their departments and said, okay, I'm done. I think we're going to have a huge brain drain. So I do worry about sort of the way we fund and back public health being transitory and based on headlines, but I worry about sort of a chronic, long-term internal impact from people who are 15 months into this and have been working 7 days a week. And it's, you don't have to talk to very many of them to really see the exhaustion. And I'm sure you feel it. It's significant.
Marie, you have a question?
Yeah. Yes, I thought I would just ask it rather than put it in the chat box. So, Charlie, I was going back to your last comments about sort of the health behavior change, which I appreciate. And I'm wondering what ideas you might have that we as academics could do to counter, as you say, market and political forces.
Yeah. Thanks for tossing that out, Marie. We've talked about this a lot. I think we really need to learn to be more nimble. So much of this is based on technology and online communication, which moves so fast. It's been a frustration of mine for years trying to do evidence-based and research-based practice, that by the time something gets through research funding and then conducting research and then gets into publication and then gets into our hands, the technology has already changed 2 or 3 generations. I think we need to find ways to be more adaptable and to keep up with how the general public and the people whose behavior that we are interested in and whose health behaviors are harmful to themselves get their information. Boy, I'll tell you, Coca-Cola and Kraft and the tobacco industry, the vape industry, they're not that slow. A new platform comes out and they've got their focus groups. They find out who's in junior high and what they're using on a week-to-week basis. And we're months or years behind that. So I think that's a big piece of it, is just finding new ways to be agile and to keep up with the reality of what's going on. And when we did our OSU vaping initiative a couple of years ago, we found out that there's a significant number of OSU students who, I forget what the industry calls them, these role models who get money from the industry to wear certain clothes or ride a certain bike or vape a certain product and get on their social media and promote that, and they get $200-300 a week. It's not overt advertising, but they're just saying, look at me using this product and being influenced. That's the word I'm looking for, is influencers. And I know that people were surprised and astonished that even here in little tiny Corvallis, on the OSU campus, there were students who were actively promoting the vape products, sort of unbeknownst, and in a parallel universe to where we were functioning in trying to counter those behaviors.
Thank you.
So Charlie, you talked about your concern about burnout and people leaving the workforce and being demoralized. But at the same time, we are experiencing a huge increase in interest in health careers, including public health. So what's your message for students, for future public health professionals that start a career right now at this very interesting juncture in our field?
Boy, I think they're in the right place at the right time. I think there will be a lot of new opportunities. I would like to see a bit more emphasis, or at least more attention paid to building those self-care skills and awareness of the impact of having being sort of on the front line. And it's really in the headlines now, and we see it now, but this is a long-term problem. You hear the same thing from people who've been in the tobacco wars for 3 and 4 generations, and we have these heroes who've seen it through, the reproductive health wars, and Marie's been a piece of that. But, how many people do we know who just the incremental and really difficult progress and changes and lack of progress are just demoralizing, just because of the nature of public health. Things move so quickly. The survivors have the watchword is patience and incremental change, but that's wearing. It's difficult, it's challenging, and all along we see people being impacted, by putting their lives and their careers and their dreams on really intractable problems, and then being worn down because the change is so slow and so incremental and so frustrating, and just continually having to fight the same fight over and over again. So I think a bit more attention, as they come up through education and in their early professional careers, some skill building on how to cope with those those long-term pressures.
Well, thanks, Charlie. We are about done. It's 1:59. So thank you so much for joining us today and for your thoughts, and very inspiring. And again, especially for all your work for Benton County and for the rest of the people you have served throughout your career. And congratulations on your retirement, and best wishes, and look forward to running into you in the farmers market and elsewhere. Thanks.
It's a pleasure. Thank you. Look forward to seeing you all and staying engaged.
Thank you.